Hi everyone, this is Professor Wagner. Welcome to week 1 in chapter 1. This week we're going to talk about cell function. We know that cells are the building blocks of the body, but now we're going to take that one step further and understand the impact that disease has on these cells at a cellular level. Understanding how cells work and how kind of we get some disorders or how different environmental factors influence things can help us make decisions as when we're thinking about treatment options for our patients. Cells are basically these tiny micro mini organisms that have evolved over many, many years, and they have some important parts of them. When a bunch of these cells work together for a specific function, that's when we have something called tissue. Again, it's just a group of cells that are all working together. We have different components of the cell, and those include cytoplasm, which is basically the supporting part that contains water, nutrients, ion, dissolved gases, and waste products. The organelles perform the work of maintaining the cell's life. And then the nucleus, you can think of, it does contain all the genetic information, which we're going to talk about in a little bit, but that's kind of like the powerhouse of the cell. It regulates growth and reproduction of the cell. Think of it kind of like the brain in the body. And then finally, we have the cell membrane, which is a semi-permeable lipid layer in which things can go back and forth in and out of the cell. Cell permeability is when substances pass through the membrane while stopping others. This depends on what kind of cells they are, and some cells are closed by proteins, chemical signs, or electrical charges. It kind of depends where they are in the body and what kind of cells they are. Diffusion is when solvents move from a higher area of concentration to a lower area of concentration. This is generally a passive process. And if you think about how potassium and sodium work, which we'll talk about in a few weeks, that is, they happen by diffusion, which is a passive process. Facilitated diffusion occurs with the assistance of a carrier module. And the easiest example of that is to think about insulin. Insulin transports the glucose into the cell. So moving along with how the materials get exchanged, there's another process called osmosis. And this is basically, again, solvents are moving from a low to a high area. And this depends on hydrostatic pressures and colloid osmotic pressures. These can if you get too much increase in the solute or too much in the osmotic pressure, you could possibly have too much water in the cells where the cells burst and break. And I think the easiest example of this to think about is that if you've ever had a neurological patient and we need to give them IV saline in the hospital, we always say don't re-give them too much saline at one time, because again, if we do, we're giving them this like free water where the cells can burst and lysis can happen. And lysis is death of the cell. Active transport is when movement goes from a lower to a higher concentration area. And this generally involves a carrier model. A good example of this is the sodium potassium pump, and there's a good video in the supplemental materials to explain how that works. Endocytosis is when substances too large enter the cell by other mechanisms. I want you to think about this like from an immune sense. So your immune system will basically attack and destroy bacteria, and they enter the cell. And when they enter the cell destroys it. It's actually pretty cool that that happens. When you have exocytosis, that's where the release of this from the materials from the cell into the cell membrane. And this usually happens with the assistance of a vesicle. And this is generally guided by the secretion of hormones. So now that we have all these cells doing this work, we have to fuel them because that's very important. There are two main fuels, and that includes the breakdown of glucose and the breakdown of triglycerides. So after you have something to eat, the food goes into the GI tract. It's converted into larger molecules and then stored until needed. Eventually, it is metabolized to make ATP, and ADP production is an anaerobic and an aerobic process. And this is where you might think back to the Krebs cycle. A good example of this situation is when the cells are not getting enough oxygen, an anaerobic process happens, and ATP is released, which causes lactic acid. This provides some energy to the cell, but because the cell does not have enough oxygen, it produces increased lactic acid. So if you think about a patient who is septic or having a heart attack, this is where those lactic acids go up because the cell does not have enough oxygen, and the body is thinking it's helping itself, but it's actually making itself worse. When we think about the other parts of the cell that include chromosomes, DNA, and genes, chromosomes basically are a list of instructions. They consist of the DNA and the proteins. This is where cells reproduce to make new ones, basically. The DNA contains the genetic codes for the cell, and a gene is the double helix DNA that we find. Each person has 46 chromosomes, and then there are different branches off of each chromosome. And then we have genomes, which are a complete set of the data of the DNA and the genes. So that's kind of like a graph, and that's how we can figure out different diseases and things like that, because we do a genome to figure out the different parts of the DNA. We're talking about replication and differentiation. Replication is basically what the cell wants to do. It just wants to live, and that's its basic requirements. The other thing it really wants to do is divide and reproduce. When it does that, that cycle is regulated by the cytokinins and the genetic materials. Then we have another way that they break down, and this is mitosis. This is where you have one cell divided into two genetic smaller cells that are exact copies. So it's one cell that divides into two. When you have meiosis, that is only happens between a mature sperm and an ovum, where at fertilization, they form a combination where the sperm and the ovum each give 23 genes to make the total of 46. So that's where two different things are coming together to form one. So that's how you can tell the difference between them. Differentiation is when basically the cells become kind of like what they're supposed to become. Cells are different depending on where they're located in the body. Your brain cells are different than the muscle cells. Your skin cells are different than your heart cells. And differentiation is basically what they do as they mature and become what they're supposed to. The pluripotent embryonic stem cells, these form in an embryo, and they have over 200 different functions that they will eventually do. These can be affected by environmental factors. And the interesting thing about these cells is that they become parts of the body, is that by the time that this happens, starting immediately until about day 50, sometimes women don't even know they're pregnant. So you can see when all these important cells are manufacturing themselves, you have to minimize environmental factors, which is why when we have women trying to get pregnant, we have them take folic acid ahead of time. We have them avoid alcohol and avoid drugs. Again, avoid smoking to minimize the environmental factors that possibly could influence the differentiation of the cells. And then we have adult stem cells. These basically do the maintenance and repair of all the tissues and replenish the cells that have died. When we look at tissues, there are different kind of tissues. The epithelial is basically the skin on the outside and the interior side of the body. You'll hear something like squamous or columnar cell shapes. That basically tells you what they look like. But the reason that it's important to know that is sometimes you'll hear when someone is diagnosed with cancer, they'll say it's squamous cell cancer. So then you know it's some kind of lining of the body. For instance, these squamous cells are usually located in the mouth, the esophagus, the vagina, and then when the cells spread and reproduce rapidly, these cells' jobs are absorption, secretion, and excretion. They reproduce relatively quickly. We have connective tissues. These are a larger set of cells and matrix and combination, and these kind of cells provide support and help you stand. They provide kind of bigger functions within the body. Then we have the muscles, and they are made up of fibers consisting of actin and meiosis, and those basically make the cell move by shortening and lengthening the fibers based on the directions that it's receiving from the brain. Muscle cells do not reproduce, and there are smooth muscle cells, cardiac muscle cells, and skeletal muscle cells. Then we have neural cells. These are composed of neurons, and basically their job is to process and transmit information to the body, so the body knows how to function. Cells tend to be very creative. They adapt to their environment to maintain homeostasis. The one thing cells want to do is live. So they will do whatever it takes to live and adapt. Some of the changes that we can see are something called atrophy. I think that if you think about like the atrophy of a muscle, basically what happens here is the cells and the cell numbers decrease, and that's from basically lack of using something. It conserves the energy and the resources of the body. This can be caused by inadequate nutrition, ischemia. Sometimes if you notice people with uncontrolled diabetes, have atrophy or weakness of their muscles. Sorry. Atrophy is when the cells increase in size, and this leads to increase organ size because it's trying again to work as hard as it can to meet its work demand. And if you think about your bicep, if you're doing weightlifting, that gets bigger because again, you're requiring more work of it. You also might hear the term left ventricular hypertrophy, which is where the left ventricle cells enlarge, and that generally happens from high blood pressure, and that's not necessarily a good thing. But the whole point is that those cardiac cells are getting bigger to meet the increased work demand on the heart and transport the oxygen. Hyperplasia cells, that is where cells increase in number and they're also capable of meiotic division. These are the cells that aid in wound healing, liver regrowth, and menstruation. Metaplasia is when adult cells are replaced by less mature cells, and that's usually caused by chronic irritation or inflammation. An example of that would be changes in the cilia in the airway from smoking. Those less mature cells take over, but then once you stop smoking, within a certain amount of time, the adult cells come back. Dysplasia is mutation of the cells into a different size and shape and appearance, and they are often precancerous. The interesting thing is when cells are at that stage, if the trigger can be removed, a lot of times they will not turn into cancer. If you think of like esophageal dysplasia or Barrett's esophagus, that's where there's a mutation of the cells. And they see that on the microscope when they look at the tissue. But then if we give someone medicine to decrease their acid levels and they make lifestyle changes, they can heal themselves and they won't progress any further. So we're going to talk about some cellular injury and cellular deaths. Probably, again, using your experiences that you've had over the course of your career, you know that the heart and the brain can only last a few minutes without oxygen. Other connective tissues can last longer, but the brain and the heart are so sensitive to oxygen, lack of not having them will result in injury or death of the cell. Sometimes it's reversible and sometimes it's not. They have many different causes. A physical example of that would be extreme temperatures. There could be a chemical injury or a radiation injury. There could be biological agents, and by that could mean viruses or bacteria. This can also be caused by nutritional imbalances or hypoxia, where the cells aren't getting enough oxygen, genetic changes, or free radicals. There are different effects of ischemia. One is hypoxia, where there's actually lack of blood flow or oxygen. Infarction refers to when the cells are so damaged that there is no way that they will live. And necrosis is actually caused by specific enzymes that dissolve and liquefy the cell. And I think if you think about like a necrotic tissue or a necrotic wound, you've seen that they can look pretty ugly, but that's what it looks like when the cells are in the process of dying. There's different types of necrosis. There's liquefaction, casus, fat, and coagulative. One of the other things that you might see is gangrene, and that is caused by impaired blood flow and bacterial invasion. The important thing to know, and this is a hint that this is probably a test question, but the bacteria that is most common with gangrene is Clostridium. When someone has a dry gangrene, often the skin is black, but it has a very dry appearance to it. Sometimes you'll see wet gangrene, which is where something is has a wet appearance to it and it's black. That's a little bit more of an emergency to take care of. Dry gangrene, we usually don't do too much about right away until we're kind of forced to, because there's already lack of blood flow to that area. And then if you surgically remove it or open it, you have less chance of healing because of already having a lack of blood flow. So we really don't try to do surgery on these unless we have to. The one that is a surgical emergency is if you have gangrene that causes gas under the skin. And if you have Clostridium underneath the skin, that causes, as that replicates, it causes bubbles or gas underneath the skin. And if you do an x-ray, you'll actually see that on an x-ray, and that's a surgical emergency. Those cells have to be removed right away to get those air bubbles out from underneath the skin. As far as a reactive oxygen species, that is ROS. That is basically it's a domino effect from an unstable agent. The way you can think about this is kind of like a free radical. That means they're out there causing injuries. They're unstable agents, but you've heard that we think that these are caused by inflammation. They can also be caused by hypertension, heart disease, or cancer. But free radicals, I think, are going to be a thing we hear a lot more about going into the future as we're trying to treat and cure more diseases. So apoptosis is when the cell death is programmed and elimination of the unwanted cells. This can result from environmental triggers. An example of that would be chemoradiation to get rid of cancerous cells. The way to prevent this is to do things to take steps to prevent cancer and keep your immune defenses up. There are some times that this happens inappropriately, and you can think of the degenerative neurological diseases like Parkinson's or dementia. The other thing you might think of is ischemia of the heart or the brain, and autoimmune disorders where there's a programmed death and those cells are not wanted anymore by the body. Now moving along to neoplasms. This is where the DNA are copying themselves, but there's some kind of error in there. And they are usually caused by mutations from environmental factors. Again, we're down to things. Smoking, by the way, is always an answer as a health promotion. It's a environmental factor that'll be on every test you ever take, right through your certification tests. If smoking is there, it's always a good answer. But this can also be caused by things that like exposure to chemicals, different things like that. So basically, these can be hereditary or acquired. And neoplasm is another word for cancer as well, just in case you're kind of trying to put that all together. There are different kinds of neoplasms. I should clarify that we often call neoplasms cancerous. They can develop into cancer, but not all of them will. Basically, though, the neoplasms, their cells are just not doing exactly what they're supposed to. And there's something called anaplasia. That it means that the cells have a loss of differentiation. But what that means in English is that as these cells divide, they don't necessarily look like their host cells. So for instance, if someone has cancer, when you look under the microscope, cancer cells, liver cells look a certain way. And then if you look at a biopsy and you see cells that are irregular, someone may have liver cancer and their cells kind of look like liver cells, but not really. So they basically take on a new appearance. The cell of where they came from is called the parent cell. And then as they change, you can still tell where it comes from, but the cells grow, sometimes for better or for worse. But there are different naming conventions for malignant and benign tumors. And if you look on page 23 in your book for table 1.2, I will tell you right now, there will definitely be test questions on being able to define the difference between benign and malignant neoplasm. So please make sure that you include that in your study. So benign neoplasms are when something looks similar to its original cell. It's differentiated and they often have slow growth. These are not fast-growing tumors at all. Frequently, they're encapsulated, which means if you think about the word capsule, the tumor is contained in a specific area. They are localized and generally do not spread. They also very rarely have systemic side effects. They are not life-threatening, except with when this happens in the brain. Remember, the brain is encompassed in the skull, so it only can expand so far before intracranial pressure increases. So if you have a large benign tumor in the brain, it can cause other parts of the brain to not function well. So sometimes you do have to have benign brain tumors removed. They're not necessarily life-threatening, but if you leave them there, they certainly can be. So malignant neoplasms are when the cells are undifferentiated and they're non-functioning and they do not look like their host cells. They are different shapes and sizes, there's different numbers, there's different purposes and functions. And this can all be related back to genetic factors, epigenetic factors, and microenvironmental factors. If you look on table 1.3 in your book, you'll see that there are common sites of metastasis. So these malignant neoplasms can spread throughout the body, usually through the blood or lymphatic system. So it is important to kind of know, if you're talking to someone about a different kind of cancer, where exactly it can spread. So there are common places that different cancers commonly go. So for example, breast cancer commonly metastasizes to the bones, the liver, or the lung. So you may find that someone has a lung tumor, and then when you biopsy it, you may see that it kind of looks more like breast tissue. So you would go looking to see if you could find, you'd probably do mammograms to see if you could find out if the breast is the primary site. So the primary site is always the driver of the different spots of metastasis. And that's important to know because you'll use that a lot, unfortunately, throughout your career. So when we talk about the phases of carcinogenesis, and this is basically how the cells mutate. It can happen from when normal cells are exposed to an environmental substance, again, like chemicals, viruses, radiation, and there's some kind of event that happens. There are acquired and inherited mutations. And if you look at tumor suppressor genes, these are where there is a loss of the breaking ability of the cancer. So the cancer cells are not stopping and they increase. And the most common one that you've probably heard of is the breast carcinoma 1 and 2, which is otherwise known as BRCA 1 and 2. These can actually be tested for in the blood. And if women are BRCA1 or 2 positive and they have breast cancer, sometimes they will also recommend you have removal of your ovaries because, again, it's a common metastatic site. And when you have that positive tumor suppression gene, it will make you more prone to get that. I will tell you, there are 2 pages of common suppressor genes. You can read through that and be familiar with it, but there will not be any super in-depth questions on that. If there would be any, it would probably be on the breast carcinoma. But I'll give you all that information when we do our test review. The next phase would be promotion, when the mutated cells are exposed to factors for growth, which can be things like hormones, nitrates, or nicotine. The cells basically form abnormalities and start to look different. Through these mechanisms, they have DNA that changes, and the translation and prescription. Basically, something goes wrong with the DNA. And that's how you get to the next step of this. An example of how your body changes this way would be when a woman's body changes to accommodate a fetus. Now, this can still be reversed at this stage, depending on what the event was that caused the promotion of the cell growth. Oh, I'm sorry about that. Then when we get to the next stage, which is progression, that is where the tumor invades and metastasizes, and there is permanent and irreversible damage. Metastasis usually happens via the circulatory system or the lymphatic system. And basically, where the metastasis is depends on the adequate blood supply, the location, and the host factors, or for lack of a better word, where the primary site is. And these cells can be very tricky. There's something called angiogenesis, where actually a tumor diverts blood from surrounding tissue and grows its own new vessels to live. These cancer-causing tumors are very aggressive, and just like our regular cells, these cells want to live too. And a lot of times our treatment is aimed at slowing that down. So moving along to talk about cancer, the most important thing to know is that prognosis is always better with early treatment. And some of the manifestations of disease that you might see are anemia, cachexia, fatigue, infection, leukopenia. You might see some thrombocytopenia, or specifically have pain, and patients get pain because the tissue is under a lot of pressure. There's tissue destruction, and there's invasion of the visceral layer where they're stretching. Like if you think about if someone has a cancer in their abdomen, their viscera may be involved, and that is stretching. And whenever there's tissue destruction, there could also be some extra inflammation that causes the pain as well. These are just some generalized manifestations, really. They're much more specific, variable by cancer type, which we'll talk about as you go through the program. So when we talk about the diagnosis and treatment, the key is really prevention, and what the diagnostic tests. After you perform a complete history and physical exam, you'll want to identify the cancer cells and establish cytology, which means basically you'll do a biopsy so the pathologist can look under the microscope to see exactly what kind of cells they are and what cells they look like. Because again, treatment plans will vary based on the kind of cells and where they are. To improve your risk of cancer, we have multiple screening tests, procedures, and recommendations. For example, we have a recommendation that women over 40 should get a yearly mammogram until the age of 75. And the other example we have is the gold standard for diagnosis of colorectal cancer is a colonoscopy every 10 years, starting from the age of 50 to 75, and maybe even 45 now, depending on risk factors. So the different stages of cancer are based on the grading and the staging. That basically tells us where it is and where it's gone. The treatment for cancer involves a combination of chemo and radiation, surgery, hormone therapy, and the hormone therapy is targeted to inhibit the growth of certain cancer cells. And immunotherapy actually alters the body's response to the reproduction of the cells. Treatment goals depend on when you found the cancer, what type of cancer it is, and that can be anywhere from curative to palliative to prophylactic. An example of prophylactic would be where women with the BRCA1 and 2 gene actually have their ovaries removed because they have those genes. So the overall prognosis of cancer, again, depends on the kind that it is, but we define cure as a 5-year survival without the reoccurrence of any other kind of cancer. It's heavily dependent on, again, what is the primary site and the cancer's ability to metastasize. We, again, focus on early treatment and early diagnosis. And remission is when cancer has responded to the treatment and is under control. The thing that we can encourage our patients to do and are to prevent many modifiable risk factors, which includes smoking cessation, weight management, and proper nutrition. But even if we do all those things properly, sometimes the kind of cancer that we develop makes no sense and no one has any risk factors. So that's why we try to encourage people to minimize the risk factors that they have control over. Next, moving along to our final topic for this chapter, we're going to talk about genetic and congenital diseases. These are caused by changes in the DNA sequencing. They can affect everyone at all ages, and they can involve any system. Some of them are quite mild. Some of them can cause serious disability or death. Sometimes they are inherited and sometimes they are acquired. There are different categories of genetic disorders, of which we are all going to go through. Multifactorial inheritance disorders are the most common, and that would include things like congenital heart disease, cleft palate and lip, alcoholism, breast cancer, schizophrenia, and anencephaly. There are different patterns of inheritance, but again, I want you to think about where the function is of the cells that are inherited and basically where they're come from. Traits come to us as different pairs of ales, and I want you to think of those as like little side hinges off the double helix of the DNA. These are things that are there and they offer further coding to our cells. Sometimes there are single gene patterns, sometimes there are multiple gene patterns that are changed, and people can be a carrier. Sometimes you have to have the same cells linked together, and sometimes you don't. There's lots of different ways that they can be inherited. First, we're going to talk about single gene disorders. These are caused by when there is one single gene alteration in the code. These are often hereditary and transmitted on autosomes. There is 4 autosomes inherent. There's autosomal dominant, autosomal recessive, X-linked dominant, and X-linked recessive. Basically, what happens is there is incomplete penetrance, which is where there's lack of development of the cells, And there is also variable expressivity, which means they have a genetic code, but it is altered in some way. In autosomal dominant disorders, these are single gene mutations. They're passed from the parent to the offspring. They can be both homozygous and heterozygous. Again, these are the different codes that are on the DNA to tell us what kind of disorder will form. The abnormalities are with the structural proteins. And how you can figure this out is using something called a Punnett square. And this is a diagram basically that helps you look at the different combinations of autosomal recessive and dominant traits that can possibly be passed off to your offspring. One of those disorders is called Marfan syndrome, and this is where there is a degenerative disorder of the connective tissue. Some of the hallmark signs of this, it happens more often in males. They're generally tall and very slender. They have long extremities with very long fingers. They also have a lens displacement, which is the ocular hallmark sign. Whenever you see a hallmark sign, that's always something you should star, because certification exams like those hallmark signs kind of things. The other thing that is probably the most life-threatening part of Marfan's is that because they are tall and lanky and their body kind of stretches longer than it should, one of the things that also stretches is their aortic valve, and these patients are prone to aortic rupture. So you will frequently be watching them if you have a Marfan syndrome patient with extra echocardiograms. Diagnosis is done basically on a history and physical, and treatments involve surgical treatments to stabilize things, steroid and sex hormone therapy, basically to limit height. And you can also consider physical therapy and different braces to ensure stability of the patient while they're walking. The other treatment, of course, would be aortic valve replacement should there be any signs of possible aortic rupture. There is a group of disorders called neurofibromatosis that arise from the Schwann cells. These are not super common, but it's good to know about because people that have these kind of disorders have increased incidence of learning disabilities and seizure disorders. They often, when you look at them, they will have multiple skin lesions, and they also frequently have nausea and vomiting and not nausea and vomiting, chronic pain. There is no cure for this. Most of the treatment is palliative along with lesion removal, just to maintain. People with this disorder can get lesions all over their body, their face. So sometimes lesions will be removed from the face so the patient can see or breathe. There's really no cure though, and it's all palliative, and pain control is another key hallmark of treating this. Autosomal recessive disorders, again, when there is a single gene mutation, but these are passed from an affective parent regardless of the sex. The usual transmission is from two carrier patients, and these are early age onset of disorders. So we're going to give an example of that. This is often referred to as PKU disorder. It causes central nervous system disorders, and currently all newborns in the United States are tested for this, because left untreated, it can cause intellectual disability. Some of the common clinical features include failure to meet milestones, microcephaly or a small head, progressive neurological decline, seizure disorders, hyperactivity, psychiatric disorders, and eczema. This diagnosis is usually done at birth or during a prenatal screening. The treatment includes dietary restrictions, where you avoid proteins and aspartame and minimize your starch intake. There are also other oral medicines that can help, and gene and enzyme therapy. Tay-Sachs disease is another disease that is commonly known. This is a demyelinating nerve cell disorder that leads to changes in your mental and neurological decline. These patients generally pass away by the age of 5. This is most commonly seen in people of a Jewish ancestry or people that have a positive family history. So again, just if you ever work with women and who become pregnant, if they are of Jewish ancestry or have this in their history, they should probably be tested for this so they're aware. Some of the clinical manifestations include an exaggerated Moro reflex, which is an exaggerated startle reflex. They often do not like loud sounds between age 3 to 5. You may also notice that they lack the ability to sit up or lift their head or grasp objects. Commonly, they also have seizures. They are prone to pneumonia, deafness, and blindness. Treatment is basically supportive with nutrition, seizure control, and pulmonary hygiene. And again, unfortunately, their life expectancy is not that long. Now we're going to talk about sex-linked disorders that are recessive or dominant, mostly X-links. X-linked means that there are very little genetic material on the Y chromosomes. More males are affected, and they're more severe with the presentation. They also can have inheritance patterns when a female has 2 recessive codes on their genes. Basically, you have to have a match from each parent to get the disorder. An example of that is Fragile X syndrome. This is the most commonly known as Down syndrome. Some of the clinical manifestations include intellectual, behavior, and learning disabilities, a prominent jaw or forehead. Sometimes they can be on the autism spectrum. They also have a long, narrow face and can often be hyperactive and have some anxiety, social disorders. And unfortunately, there is no cure. All the treatment is supportive. Parents are often offered genetic counseling before they conceive a child or after they've conceived. And basically, it's supportive care with behavior and psychological support and intensive therapy. We'll also, when we have these kind of patients, we need to make sure we're taking care and my mistake, Fragile X syndrome is not Down syndrome. That's the next disorder we're going to talk about. It is the most common disorder after Down syndrome. I'm sorry, I misread my notes. And this usually develops around the age of 2 to 3. Next, we're going to talk about chromosome disorders, and this is a major category of genetic disorders. This basically results in some kind of alteration of the chromosome number or structure. There can be, sometimes there are more than 23 pairs and sometimes there are less. Unfortunately, again, talking about when you first become pregnant, when the uh, embryo is between 15 to 60 days old gestation, that is when these environmental factors can really affect some of these disorders going on. So again, that's why we always encourage women to follow some basic instructions that we talked about earlier. A lot of times as well, sometimes when women are very newly pregnant and they have a chromosomal disorder or a structural disorder, it will result in a spontaneous miscarriage because of those factors. And now we're going to talk about Down syndrome, which is trisomy 21. This is a spontaneous chromosome mutation where there are 3 copies of chromosome 21. These patients often have hypotonia, distinctive facial features, heart defects, varying intellectual disabilities. They often have a delay in puberty. They can be impulsive and have developmental delays. The risk for having a child with trisomy 2 increases as age increases, and you also have increased risk when you're exposed to environmental or tetragonic exposures, like if you've had chemotherapy or radiation, or even in the healthcare field, if you work in a radiation area, you need to protect yourself so you're not exposed to those as well, and tetragenic risk factors. This can also lead to complications and increased risk for other ultrasounds. Prenatal diagnosis can be made on 4D ultrasounds, amniocentesis, and serum hormone levels. They can often check for Down syndrome as part of a workup for high-risk couples to let you know if your fetus has it or not. Most of this treatment is symptomatic and management of different complications. Turner X syndrome is where there is deletion of all or part of the X chromosomes. It only affects females. They have a short stature. They have lymphedema usually in their hands and feet. They have a broad chest with widely spaced nipples, low set ears. They often have decreased bone mass and increased weight. And another key feature is a horseshoe kidney. They also develop gonadal streaks and do not get their period. The treatment for this is female sex hormones. Chromosomal structural disorders is where there is some kind of error in cellular division, again, with environmental causes, inherited causes, or a combination of those, and there are different ways that can happen. Multifactorial disorders are when there is an interaction between multiple genes and environmental factors. And again, these are the most common. Sometimes they're inherited or acquired. Sometimes there's no clear pattern of inheritance, and sometimes they appear early or later in life. I think it's important to note that environmental factors can include tetragens, which includes infectious sources, chemicals, or radiation. And it's important to know the history of your blood relatives, because the closer you are to the relative, the increased chance you have of hereditary or inheriting a disease that they will have. And we're going to talk next week about doing a genetic genome so you can become familiar with your family or a family member of a friend, so you can see how you assess for risk of diseases. One of the diseases that I want to talk about is cleft lip and cleft palate. This is where the soft tissue of the mouth or the lip do not form properly. The most significant risk factors for developing this are maternal smoking, pre-existing diabetes, or seizure medication use. Make sure you remember those. It can be unilateral or bilateral on one or either side of the face. Part of the treatment is feeding, making sure they're well fed and meeting their nutritional needs. Often they require surgical intervention and need speech therapy and lots of parental support once the diagnosis has been made. So I will post this with the PowerPoint online. I hope that you learned a little bit about our cells and how they work and the genetic codes, and I hope I was able to link it to some real life examples that you may know from your career as a nurse.